Welcome to the deep dive. If you've ever been jolted awake by your dog needing an urgent bathroom break, well, you've probably wondered what's going on.
Uh-huh. It's stressful.
Totally. Today, we're diving into a common yet often misunderstood issue: Clostridial enterotoxicosis in dogs and sometimes cats.
Right.
It's a condition linked to recurring diarrhea and specific toxins produced by Clostridium perfringens bacteria. Think of this as your shortcut to understanding this frustrating problem.
Exactly. We've gone through the medical literature, the textbooks to sort of pull out the most important pieces for you.
Great.
So if you've been searching for answers behind your pet's on-again, off-again tummy troubles, this deep dive is definitely for you.
And the goal here.
We're aiming for clarity, not getting bogged down in overly complex science, but making sure you come away with a real understanding of what Clostridial enterotoxicosis is all about: causes, symptoms, how it's diagnosed and managed.
Okay, let's unpack this then. So in simple terms, what is Clostridial enterotoxicosis?
In essence, it's diarrhea in dogs and cats. It's linked pretty directly to toxins made by this bacteria, Clostridium perfringens.
Okay.
The best evidence we look for involves actually finding a specific toxin. It's called CP enterotoxin, or CPE,
CPE, got it.
and also finding strains of this bacteria in their stool that can produce toxins. We call those enterotoxigenic fecal isolates.
Ah, okay. So not just any C perfringens.
Exactly. And importantly, it's often associated with cases of diarrhea that, well, they get better when the pet is given antibiotics. That's a clue.
Interesting. Now, this Clostridium perfringens, is that like a bad bug that sneaks in from outside?
That's what's fascinating here. Clostridium perfringens isn't typically an invader. It's actually a normal resident of the gut.
Really? In healthy animals, too?
Yep, in both people and our pets. It exists in what we call a vegetative form, just
Yeah.
part of the everyday community of microorganisms living in the intestines.
Like a neighbor who usually keeps to themselves.
That's a good way to put it. Usually it's fine.
Okay, so if it's usually there and behaving, what makes it suddenly cause problems? What flips the switch?
Right. That's where specific types, generally categorized as type A, come
Yeah.
into play. Now, these can produce something called alpha toxin,
Okay.
but more importantly for this condition, a more potent toxin called CPE. That's short for Clostridium perfringens enterotoxin.
And CPE is the real troublemaker here.
It seems to be, yeah. It latches onto the lining of the intestines, messes with how easily things can pass through the cell wall's permeability, we call it.
Right.
And that can ultimately damage or even kill those intestinal cells. This disruption isn't just about diarrhea either. It can have wider effects like inflammation, maybe nutrient absorption issues.
Which explains why chronic cases can lead to pets seeming generally unwell.
Exactly. It's more than just loose stool sometimes.
Yikes. So what makes these normally harmless bacteria start pumping out this CPE toxin?
It's linked to the bacteria undergoing a specific process called sporulation.
Sporulation.
Think of it like the bacteria forming tough, dormant structures, spores, to survive potentially harsh conditions. And CPE production is often tied to this process.
Okay, so what triggers this sporulation in pets?
Several things, it seems. Sudden changes in their food are a big one.
Like switching brands abruptly?
Yeah, or even just a big change in ingredients.
Hmm.
Also, eating things they shouldn't, what vets call dietary indiscretion.
Ah, the classic garbage raid.
Precisely. Also, sometimes the misuse of antibiotics can upset the balance of their normal gut bacteria. We call that dysbiosis.
Oh, right. So antibiotics can sometimes make things worse.
Potentially, if they disrupt the balance in a way that allows C. perfringens to flourish or sporulate. And underlying intestinal issues, like inflammation or other diseases, can also play a role.
So it's not just about the bacteria itself, but also what's happening inside the pet's gut, the environment.
Exactly. We have to emphasize that host-related factors, things specific to the animal, definitely influence both how much CPE gets produced and, importantly, how much harm it actually causes. It's a two-way street.
That makes a lot of sense. It's complex. Now, who is most likely to be affected by this? And how common is it, really?
Well, Clostridial enterotoxicosis is mainly seen as a concern for dogs. It seems to happen less often in cats,
Okay. Dogs primarily.
primarily. And while we don't have exact numbers on overall occurrence, it's suspected, based on studies, that it might be involved in maybe up to a third, like 34% of all diarrhea cases in dogs.
Wow, that's quite significant.
It is. It can affect dogs at any stage of life, any age. But we do often see the chronic cases, those ongoing or recurring bouts of diarrhea, more frequently in middle-aged or older animals.
And I think you mentioned something about hospitals.
Ah, yes. It also has potential as a hospital-acquired or nosocomial diarrhea, meaning it can sometimes develop while a pet is already in a veterinary clinic or hospital, perhaps due to stress or other factors there.
Okay, so shifting gears a bit, what kind of clues might a pet owner notice at home that could point towards this condition? What does it look like?
Generally, there are two main ways it presents. First, you might see an acute form.
Sudden onset.
Exactly. The diarrhea starts suddenly, but it tends to clear up on its own, usually within about 5 to 7 days. Self-limiting, we call it.
Okay, that's one type.
Then there's the chronic form. This is marked by intermittent episodes of diarrhea. They might come back, say, every 4 to 6 weeks, and this pattern can unfortunately stick around for months or even years in some cases.
That sounds incredibly frustrating for owners.
It really is. And these recurring episodes can sometimes be triggered by specific events, like stressful situations, maybe hospitalization, like we mentioned, or being boarded in a kennel.
Huh, stress is a trigger again.
Seems to be. And just as a side note, Clostridium perfringens has also been found in connection with a more serious condition called acute hemorrhagic gastroenteritis, or HGE.
HGE, that's the one with sudden bloody diarrhea, right?
That's the one, very severe. And C. perfringens is sometimes observed alongside parvovirus infections too, although the exact role isn't always clear.
Okay, so for the more typical, maybe less severe cases, what specific signs of diarrhea might an owner see?
The most common signs often suggest the problem is mainly in the large intestine, the colon.
What does that look like?
That often includes diarrhea that contains mucus, sometimes small amounts of fresh, red blood. The stools might be small and maybe not very frequent, surprisingly. And the dog might seem to be straining to poop.
Tenesmus.
Exactly, tenesmus. Often with more frequent attempts to go, even if not much comes out.
Okay, so large bowel signs. What about small bowel?
It's possible. Some dogs might show signs more typical of a small intestine issue, like large volumes of watery stool. It can vary.
Any other signs besides the diarrhea itself?
Yeah, sometimes vomiting can occur.
Yeah.
Maybe excessive gas, flatulence, more noticeable blood in the stool. We call that hematochezia. Sometimes abdominal discomfort or pain.
And in those long-term chronic cases?
In those cases, you might see a general decline in health, like poor coat, weight loss, just sort of unthriftiness. It can really take a toll over time.
I can imagine. Seeing your pet go through that repeatedly must be tough. Now, what about when the vet examines the pet? What do they typically find?
Often what's surprising is that during a physical exam, there might not be many obvious signs of systemic illness like weakness or severe dehydration, especially in milder cases.
So they might seem relatively bright otherwise.
Sometimes, yes. The vet might be able to feel some pain in the abdomen when they palpate or press on it.
Okay.
They might also see evidence of blood or mucus in the feces, perhaps on the thermometer after taking the temperature. But importantly, a fever is usually not present with this condition.
No fever. That's a key point. It sounds like it can be a bit of a puzzle to figure out then. Is it like a true straightforward infection, or is it more complicated than that, like the bacteria just taking advantage?
That's a really insightful question, and honestly, the full picture is still not completely understood.
Yeah.
It might be more accurate to think of it as an opportunistic scenario in many cases,
Opportunistic meaning?
meaning the bacteria is there, maybe conditions change, and it gets a chance to cause trouble. As we discussed, only certain types of C. perfringens even have the genetic tools, the genes,
Yeah.
to produce CPE. And even among those that are exposed or carry those strains, only some animals actually become clinically sick. So it's not inevitable.
So other factors must be involved.
Definitely.
Mhm.
There's a possible link to something called small intestinal bacterial overgrowth, or SIBO.
SIBO, where there are too many bacteria in the wrong part of the gut.
Essentially, yes. An unusually high number of bacteria in the small intestine, that could be related. And of course, it can also be linked back to those dietary indiscretions or sudden diet changes we talked about earlier.
Okay, so what kind of things put a pet at a higher risk for actually showing signs? What are the triggers?
Well, several factors seem to potentially trigger the clinical signs. Any kind of stress on the gastrointestinal system seems key.
Like what kind of stress?
Could be a diet change, as we said. The use of antibiotics, potentially disrupting the normal flora. Having other illnesses going on at the same time, either GI or even elsewhere in the body. Or even just the stress of being hospitalized.
So the overall health of the pet's gut is really important.
Hugely important. The metabolic state, the condition of the gut, lining the mucosal integrity, and the gut's immune system. All of these can influence how much of a problem C. perfringens becomes, how pathogenic it is.
Interesting. Any specific immune issues linked?
There's a possible connection, though maybe not fully proven, to a deficiency in something called IgA.
IgA.
It's a type of antibody that's really important for protecting mucosal surfaces, like the gut lining. So a lack of it could potentially make an animal more susceptible.
Okay. Anything else about the gut environment?
Yes, actually. It seems that a less acidic or more alkaline environment in the lower intestines can actually encourage C. perfringens to go into that sporulation phase.
And produce the CPE toxin.
Exactly. And finally, as we touched on with SIBO, just having a primary overgrowth of bacteria in the small intestine itself could be a contributing risk factor. So you see, there are quite a few potential elements that could nudge things towards disease.
It really is a complex interaction. Okay, so a vet suspects Clostridial Enterotoxicosis based on the history and signs. How do they actually go about diagnosing it? It sounds like, as you said, a bit of detective work.
It definitely can be. Suspicion should probably be higher in any case of diarrhea that is either sudden, acute, or chronic, and intermittent comes and goes.
Right.
And a really important point, it's best to try and perform any specific diagnostic tests while the pet is actively having diarrhea.
Why is that so critical?
Because the evidence, the C. perfringens spores or the CPE toxin itself, might actually disappear or drop to undetectable levels between episodes. So
Yeah.
timing is key.
Okay, test when symptoms are present. Good tip.
And it's also crucial to remember something we mentioned earlier. Just because a dog's diarrhea gets better with antibiotics doesn't automatically confirm Clostridial enterotoxicosis.
Right, because other things might respond too.
Exactly. Many bacterial causes of diarrhea, or even non-bacterial ones, where secondary infection is suspected, might improve with antibiotics. So it's suggestive, but not proof on its own.
Makes sense. So what else do vets need to consider? What do they need to rule out? What's the differential diagnosis list look like?
Oh, it's quite broad. As with most cases of diarrhea, you need to think about and rule out things like intestinal parasites, worms, giardia, things like that.
Standard checks.
Yep. Then there's inflammatory bowel disease, IBD. Also chronic idiopathic colitis, which is basically long-term inflammation of the colon where we don't know the exact cause. And even irritable bowel syndrome, which is thought to be more related to motility and stress.
Lots to consider. What about blood work? Can that help?
It can give clues. It might show signs of dehydration, what we call hemoconcentration, where the blood looks thicker.
Okay.
And in those severe HTE cases we mentioned, blood work might show a very high packed cell volume, the red blood cell count, relative to the total protein levels in the blood. That pattern is quite characteristic of HTE.
Gotcha. Now, what about the specific lab tests aimed at finding C. perfringens or its toxins? You said there's no single perfect test.
That's the challenge. There really isn't one gold standard test right now. For instance, simply doing a fecal culture to see if C. perfringens grows. Well, that isn't very helpful diagnostically.
Because it's normally there anyway.
Exactly. It's commonly found in the feces of perfectly healthy dogs, so just finding it doesn't mean it's causing the problem.
Okay, so culture alone is out. What else?
There are specialized fecal cultures that can count the number of spores, those dormant structures. And yes, sometimes high spore counts do correlate with disease, but these tests aren't routinely performed in most clinics, and interpretation can still be tricky.
What about testing for the toxin itself? CPE.
There's a test for that, an ELISA test, that can detect the CPE toxin in the stool. That can be helpful, but
There's a but.
there's a but. The challenge is that CPE can sometimes be found in a small percentage of healthy dogs, too. And, maybe more confusingly, it can be found in a higher percentage of dogs who have diarrhea for other reasons. So finding the toxin alone isn't definitive proof, either.
So it increases suspicion but doesn't seal the deal.
Pretty much. And just to add another layer, there are other genes C. perfringens can carry, called virulence genes, like one called NETF, which has been implicated in some hemorrhagic diarrheas. Research is ongoing there.
Okay. What about PCR tests detecting the genes?
Yes, RT-PCR tests are available that can detect the gene for CPE, the creep gene, and also the gene for alpha toxin.
Is that useful?
The grape gene detection is part of the puzzle. But finding the alpha toxin gene, well, that gene is also quite common in C. perfringens found in healthy dogs, so its presence alone isn't very conclusive for causing disease.
Wow. So if no single test is perfect, does diagnosis often come down to putting together the clinical picture, the signs, the history, and ruling other things out, maybe using these tests as supporting evidence?
You've hit the nail on the head. That's often how it works in practice. It's about pattern recognition, the type of diarrhea, the chronicity, the response to treatment sometimes, ruling out common culprits, and then using the specific tests to build confidence in the diagnosis.
So what is the most reliable diagnostic approach currently, combining these imperfect pieces?
The most accurate diagnosis, or the highest level of certainty we can get right now, generally involves finding both the gene that allows the bacteria to make the toxin the CRAPE gene via PCR, and detecting the actual CPE toxin protein itself via ELISA, all in a dog that is showing clinical signs that fit the picture.
Both the gene and the toxin. Okay.
That combination strengthens the case considerably.
What about looking at the poop under a microscope? Fecal cytology.
Yes, vets often do that.
Yeah.
They might look for the characteristic safety pin-shaped spores of Clostridium perfringens.
A safety pin shape. That's a memorable image.
It is. However, again, just finding a high number of these spores doesn't reliably indicate disease on its own. Healthy dogs can sometimes shed a lot of spores too. So it's another piece of information, but not definitive.
Understood. Are there more invasive procedures sometimes needed?
In some particularly chronic or confusing cases, yes, a vet might recommend a colonoscopy.
Putting a camera up.
Exactly. To visually examine the lining of the colon. This can be really helpful to rule out other intestinal diseases like IBD or masses. And during the colonoscopy, they can take small tissue samples, biopsies.
What do those biopsies usually show?
Interestingly, if you take biopsies when the animal isn't having symptoms during a quiet period, they're often completely normal.
Ah.
But if you do it during an active disease flare-up, the lining of the colon might look visibly red, inflamed, maybe even have small ulcers.
Yeah.
And looking at the tissue sample under a microscope that's histology might show signs of inflammation, like neutrophilic or lymphoplasmacytic colitis.
Okay, so diagnosis really can be a bit of a detective game, putting all these clues together. Let's move on to treatment then. How is Clostridial enterotoxicosis managed once it's suspected or diagnosed?
Right. Well, the good news is that most cases can be managed effectively as outpatients. The pet doesn't usually need to stay overnight at the vet.
That's a relief for owners.
Definitely. However, if the diarrhea or vomiting is really severe, and especially if it has led to significant dehydration or electrolyte imbalances like we see in those HGE cases, then hospitalization for more intensive supportive care might be necessary.
And what does that supportive care involve?
Primarily, it's about fluid and electrolyte therapy, replacing what's been lost through the diarrhea and vomiting. This might be given as fluids under the skin, subcutaneously, or in more severe cases, directly into a vein, intravenously.
Makes sense. Rehydrate and rebalance.
Exactly. And during that initial acute phase of illness, it's also important to just let the pet rest, reduce activity.
What about their diet? You mentioned diet changes can be a trigger. Does diet play a role in recovery too?
Absolutely. Dietary management is really crucial, especially for those chronic recurring cases. It's often a cornerstone of long-term control.
How so? What kind of diet helps?
Diets that are high in fiber often lead to significant improvement. Both soluble fiber and insoluble fiber seem to be beneficial.
High fiber. Why does that help with Clostridium?
The thinking is that fiber can help by reducing the overall numbers of Clostridium bacteria in the gut. One proposed mechanism is that the fermentation of fiber by beneficial bacteria produces short-chain fatty acids, which can lower the pH, make the gut more acidic, particularly in the colon.
And Clostridium doesn't like acidic conditions.
It seems less favorable for C. perfringens sporulation and that CPE toxin production we talked about. So acidification might be key.
Interesting. So what are some examples, like specific foods?
Vets might recommend specific commercially available prescription diets that are formulated to be high in fiber.
Okay.
Or they might suggest supplementing the pet's current diet with a fiber source. Psyllium husk, like Metamucil, is a common source of soluble fiber. Or sometimes adding coarse wheat bran or psyllium to a diet that's normally low in fiber.
So adjusting the existing food is an option too.
It can be, yes. And another thing that might help, potentially, is probiotics.
The good bacteria.
Exactly. Giving beneficial bacteria might help prevent recurrences by altering the gut microbial balance, making it harder for C. perfringens to overgrow or cause problems. Think of it as reinforcing the population of good neighbors in the gut community.
Adding reinforcements, I like that. What about medications? Are antibiotics always the answer here?
Generally, no. Antibiotics are often avoided in milder cases.
Why is that?
Because, as we discussed, the acute disease is often self-limiting. It resolves on its own within 5-7 days anyway. And, of course, there's the concern about unnecessary antibiotic use contributing to resistance and further disrupting the gut microbiome.
Right, the dysbiosis issue again.
Precisely. However, if the diarrhea is particularly severe, or if there are signs that the illness is systemic, affecting the whole body, then a short course of antibiotics might be used, typically just for about 5 days.
And which antibiotics are usually chosen?
Some of the common choices that C. perfringens is usually sensitive to include ampicillin, amoxicillin, metronidazole, or tylosin. It's worth noting that tetracycline antibiotics are often not the first choice anymore, mainly due to increasing issues with antibiotic resistance in C. perfringens.
Good to know. So, besides antibiotics, are there other drugs? You mentioned probiotics as an alternative.
Yes, probiotics can be considered a supportive or sometimes alternative approach, especially for managing chronic cases or preventing recurrence. And really, for those chronic cases, once the initial signs have resolved, transitioning to and maintaining that high-fiber diet can sometimes be the primary treatment strategy long-term.
So, diet is really key for the long haul. But, we often hear about the risks of overusing antibiotics and their impact on gut health. How do vets kind of balance that concern with the need to treat pets who are really sick?
That's a really important point, and it's a constant consideration. Veterinarians have to carefully weigh the severity of the clinical signs against the potential downsides of antibiotic use.
A risk-benefit analysis.
Exactly. In those mild self-limiting cases, the focus is definitely more on supportive care, maybe fluids if needed, and dietary management, allowing the gut's natural defenses and microbiome to recover. Antibiotics are typically reserved for the more severe end of the spectrum, significant systemic signs, very persistent diarrhea that's really impacting quality of life, or those HGE cases.
Use them when necessary, but judiciously.
Precisely. The goal is to target the suspected C. perfringens overgrowth or toxin production when needed, but without causing unnecessary collateral damage to the rest of the beneficial gut bacteria if we can avoid it.
Makes sense. What kind of follow-up care is typically needed after starting treatment?
Well, in moderate to severe cases, especially those that maybe needed initial hospitalization or significant fluid therapy, it's important to keep a close eye on the pet's hydration status and electrolyte balance through follow-up checks.
Monitoring recovery.
Yes. And if a pet isn't responding to the chosen treatment as expected, that's a red flag. It might suggest that, well, maybe Clostridial Enterotoxicosis wasn't the primary issue after all, or perhaps there's another underlying problem complicating things that needs further investigation.
Back to the diagnostic drawing board, potentially.
Sometimes, yes.
What about prevention? Can owners do anything to reduce the risk?
Based on what helps manage the condition, it seems logical that feeding a diet that's consistently higher in appropriate fiber, or perhaps regularly using certain probiotics, might help reduce the likelihood of this type of diarrhea occurring or recurring. Avoiding sudden drastic diet changes is probably wise too.
Okay. And what's the general outlook? If a pet is diagnosed, how do they usually do?
The good news is that most animals, especially those with acute episodes, tend to respond very well to appropriate treatment and supportive care.
That's encouraging.
It is. But as we've emphasized, those chronic intermittent cases might require more long-term management, often centered around that high-fiber diet, possibly with probiotics, to keep the signs under control and maintain a good quality of life. It becomes more about management than a complete cure sometimes.
Right. And what about the owners themselves? Any risk to people?
That's a really important point for client education. While C. perfringens can cause food poisoning in humans, the strains typically associated with this enterotoxicosis in dogs and cats are generally not considered a significant zoonotic risk. There's currently no evidence suggesting transmission from pets to humans causing this specific type of illness.
Okay, that's reassuring for pet owners.
Definitely. And just reminding them that acute disease is often self-limiting can also reduce anxiety.
Great. So just to kind of recap the key takeaways for everyone listening, Clostridial enterotoxicosis, it's a relatively common yet kind of complex cause of diarrhea in our pets, especially dogs.
Common but tricky.
Right. It involves specific toxin-producing strains of a bacteria that's usually just hanging out in the gut.
A normal resident, yeah.
And it often gets triggered by things like shifts in diet, maybe stress, or the use of antibiotics. Figuring out the diagnosis isn't always simple. It can feel like putting puzzle pieces together.
Definitely requires some detective work sometimes.
And managing it often involves crucial dietary adjustments, like adding fiber, sometimes using targeted antibiotics for severe cases, and maybe probiotics.
That sums it up well. Diet is often key, especially long-term.
So it really brings up a final thought, maybe something for you, the listener, to ponder. Given how incredibly common Clostridium perfringens is, it's everywhere in the environment, it's in the guts of most healthy animals. What other, maybe more subtle factors in a pet's daily life, their environment, or even their internal state, their unique physiology? What might be the key that tips the balance towards disease in some individuals but not others?
That's the million-dollar question, isn't it?
Yeah.
Really highlights the ongoing complexity of the gut microbiome. We're still learning so much about that intricate ecosystem inside our pets and just how profoundly it influences their overall health and susceptibility to conditions like this. It's a fascinating area.